Hey everyone! Why does my child have bad breath? This is a question I get all the time. So in today's Tooth Talk Thursday, let's review 5 common causes of bad breath in children. There are more than 5 causes, of course, but we'll stick to 5 pretty common ones. And I think by the time you watch to the end of the video, you will have a pretty good sense of being able to identify what cause or what causes could be contributing in case that you have one of those kiddos that just has that breath that knocks your socks off. And so I get asked this question as a pediatric dentist. I get this question from parents all the time, and you know, a lot of times the parents try to like maybe whisper it or spell it out and say there's this S-M-E-L-L and it's and what do you think that is? Because they don't want to hurt their child's feelings, and I totally get that because you know, I occasionally have this problem in my home with my own young kids as well, and so we've given it a name so we can talk about it without hurt feelings. We call it dinosaur breath, but there's always a reason, and we'll start with the one that I would say is probably the easiest to control. That'll be cause number 1, we'll say, and then we'll go into some more complex ones and some that sometimes take a little bit of investigating to get to the bottom of. And here's the thing, why is it even important to try to get to the bottom of it? I mean, of course we love our kids, no matter how stinky their breath, right? But wouldn't it be great if it wasn't, right? Because if you can identify what the underlying root cause is, it's a win-win, because you've just helped them eliminate whatever issue they had, and you don't have to, you know, put up with the odor. So, by the way, we're not going to talk about any foods, even though sometimes foods can contribute, but that's a transient, temporary thing. We're going to focus on the more chronic stuff. So, the first one we'll talk about, and it's going to be sort of obvious, but really just effective, good, thorough brushing and flossing can't be overstated, because here's the thing, a lot of times parents put a little bit too much faith and trust in their children's abilities to brush their own teeth really well and effectively remove all the plaque. And here's the thing, the rule of thumb is that up until about age 8, when a child could, you know, write well in cursive, which I don't even know if they teach that in schools anymore, but that's about for as long as a parent should plan on helping their child with their brushing and flossing, because it does take fine motor skills and just a certain amount of attention to detail to really be very effective at plaque removal. And so, as you can imagine, if food particles that are starting to rot over time, or the bacteria that build you know, on and in between our teeth every day, if that is left to sit, that's going to have a bad smell. So the brushing, I'm going to just assume that everyone will know what to do there. The flossing, I want to just do a quick demo, because I think sometimes when if you have a 2 or a 3-year-old and you just heard me say floss your kid's teeth, you might be like, floss? How? Like, what do you mean? So if you're picturing the long string floss, no, you're not going to want to use that. That's very hard to do in someone else's mouth, especially in a little one. So let me just quickly show you what we use here. Either product is fine, and I have no affiliation with either company. I got these at Target, but you can find them pretty much anywhere, any drugstore. And what you do with those, so they're little flossers, and I'm going to use a little tooth model to do the demo, but just go in, you know, this is the front of the mouth, enter sort of horizontally, and then do like between the molars, go in, slide a little bit up and down, wipe the sides, whatever you pull out, you know, you wipe it off with your fingers or with water, whatever, and then you move on to the next site. And you do that in any site where the teeth are either actually touching or very, very close to touching when the space is small. If you have wide gaps throughout big spaces, you don't have to worry about it. But in every other case, you'll want to do this in the evenings. You can do it after dinner or at bedtime, whatever works best for your schedule. And by the way, these are very well tolerated by children. They're flavored, taste really good. I really haven't come across any kids who don't like this. Now, sometimes if the teeth are really touching tightly, you just have to make sure you're gentle and you're not jamming it down, just back and forth, a sawing motion with gentle pressure. And they may have to get a little bit used to it, but give it a try. And that should be part of the daily routine. So the other thing, let's call it in the front of the mouth, would be the tongue can harbor a lot of bacteria. So you can either actually purchase something called a tongue scraper, and unfortunately I don't have an example to show you, but you could do that, or you could use clean fingernails, honestly, to do a little gentle scraping. If you notice there's a film or a sort of a layer, almost like slimy looking layer on the top of the tongue, I guarantee you there's tons of bacteria in that, and that's going to have a bad smell. So just removing that in the evenings too, or in the mornings, just whenever, you'll see some improvement in the odor. So then now moving beyond the teeth, the rest of the stuff is all in one way or another more on the medical side, but the second one I want to talk about, there's something called tonsilloliths, or also known as tonsil stones. Unlike kidney stones, these are not hard calcified masses. These are more like congealed clumps of bacteria and food particles and some like dead mucosal or skin cells, and they are very, very stinky. The odor is very potent and it's very distinct. So for me, I can identify it very easily. If I get a whiff of a tonsillus, like I know when I see a tonsillus, but sometimes you can't even see them, so that's the issue, because they form inside what's called the crypts of the tonsils, those deep folds. So sometimes they're tucked in so deep you don't necessarily see it. But what I was getting at, the smell is so unique that if you know what that smell is, there's nothing else that smells quite like it, basically. And they can be hard to treat. I mean, they work their way out eventually, but trying to just prevent them from forming, essentially drinking lots of water, keeping that area well irrigated and hydrated, flushed, basically. That's kind of your top preventive strategy, along with gargling, depending on your child's age. If they can handle gargling, you could do warm salt water, you could do a non-alcoholic mouthwash, whatever. But if they're young, that's probably not realistic. But that's a big one. And then another cause would be acid reflux. So as you might imagine, if there's partially digested food that's making its way back up, that's going to have a bad smell coming out through the mouth. And acid reflux can be really tricky to diagnose and identify in kids, young kids especially. And so you'll want to talk to your pediatrician if you're concerned that this could be going on. Sometimes you may even need to enlist the help of an allergist, especially if your child has certain other allergy type symptoms, let's say seasonal allergies, eczema. They can help identify if there's some kind of food intolerance playing into this whole acid reflux type picture. So get some medical help if you think that could be an underlying cause in your particular case. On a related note, postnasal drainage, which again is tied to allergies and allergy symptoms, which are so common, and helping to control the allergy symptoms, whether that be by doing maybe nasal steroids or doing even just nasal saline spray, whatever the case may be. I mean, talk to a pediatrician, allergist, but controlling that will help to improve the odor, because postnasal drainage is also pretty stinky. And then the fifth one I want to talk about, and this is something I'm very passionate about, is mouth breathing and chronic dry mouth, which is so unhealthy. I mean, I don't know if there's anything more important that you can do for your child than to make sure that you get them to breathe exclusively through their nose. It's such a huge health issue that is overlooked. But mouth breathing has all kinds of adverse health effects and consequences. Not only does it affect the entire growth and development of the face and of the jaws, which therefore affects how you look for the rest of your life. So this is going to sound like a really bold statement, but the way that you breathe as a child affects how you look for the rest of your life. And also the way that you breathe affects, in children especially, I mean, their behavior, their school performance. There are kids who, may have been diagnosed with ADD, ADHD, but is it possible that they're just not getting restful sleep at night because they're exclusively mouth breathing, and they don't get as much oxygen and they're not well rested? 9 out of 10 kids actually have some kind of sleep disordered breathing issues, which is startling, but asthma and allergy issues can be linked to poor breathing, mouth breathing as opposed to nasal breathing. So trying to get your child to be the healthiest version of themselves can't even be accomplished if they're mouth breathing. So that is hugely important, and something that we would love to help you with. If you're concerned about this and you think your child, needs to be evaluated, please ask us for, we have a questionnaire that we can send to you, and then you'll see, how high risk your child might be. So we want to help your child be the healthiest version of themselves that they can be. We don't want them to breathe through their mouth, not because it leads to bad breath, that's the least of our concerns, but just because of all the overall health issues that come with it. And as I said at the beginning of the video, I'm a pediatric dentist. My name is Dr. Bana Ball. I'm the founder of Shady Pediatric Dentistry, which is Rockville's newest pediatric dental office. We're on Shady Grove Road. And let me know what you thought of the video, if you thought it was helpful, if you got some good tips and food for thought. I'm happy to hear any feedback about future topics or areas that you might be interested in. Just let me know. And also just to indulge me and to make me happy, can you type something in the comments like hi and where you're watching from? And if you're watching this live or on the replay, and just provide some kind of feedback. I would really appreciate that. And thank you for watching. And check back in next Thursday for our Tooth Talk Thursday, which most likely will be on mouth breathing, because that's a huge and important topic that deserves a video all on its own. Thanks so much. Take care.